Are we going live?
He said he's starting it and he will put it on the text saying we are live. Thanks.
Okay. Sir, your OB screen also went off, Ankit sir.
Okay, sir. I think now it will be fine.
It started.
Fine, sir. It's appearing normal to
Are
you?
we going live?
And he will put it on the text saying we are live. Thanks.
Okay. Hello guys, welcome. Sir, your OB screen also went off, Ankit sir.
Okay, sir. I think now it will be fine.
It started.
Fine, sir.
The text saying we are live. Thanks. Okay.
Hello guys, welcome.
Okay, sir. Okay, sir. I think now it will be fine.
It started.
Fine, sir.
The text saying we are live. Thanks. Okay.
Hello guys, welcome.
Okay, sir. Okay, sir. I think now it will be fine.
It started. Hello everyone.
Hi folks, welcome to Physics Wallah Merit. We are connecting today to take a quick look at what happened in today's INI-CET. Okay, I do understand that many of you found this paper a bit weird or different from your previous experience. And with me, we have today Dr. Ankit as well as Dr. Ranjith, and we are open to your comments to know how the exam was for you. Let us know what do you feel about today's exam, whether it was a tough paper in comparison to previous INI-CET, if you had an experience of previous INI-CET, or do you consider it at usual level of INI-CET, or was it easier than the previous INI-CET exams?
Hello, sir. Hello, students. So, sir, the students who messaged me actually had a mixed reaction. Some students were finding it a bit difficult.
If you had an experience of previous INI-CET, or do you consider it
Some students were finding it a bit difficult, while other students, they said that it was at least easier than the previous version, the November and May version of INI-CET. Now, the issue is, sir, I personally believe it is all about the hard work the students have paid. I think the students who had done more hard work, they are finding logically it is more of a easier paper. But yes, as we know, sir, that if we see the pattern or the trend of INI-CET, all the questions, it is similar to the previous versions. 60% questions were direct repeat, 10 to 20%, yes, little bit language has been changed. And as we all expect that 10-20% of the questions, they are new questions, first time asked. So this is my take, sir, on right now this exam.
Okay, thank you, Ankit sir. Thank you, Santosh. I think I was a little bit out of it, and more of technical problems are there. And this exam, I'm sure quite a few guys must have given. And Sir Ankit sir gave a brief overview of how the exam was. It's overall the same response. It's more about the preparation, which is very, very important in judging any exam. So keeping an overall thing, like the amount of repeats or repeat-based topics were there as usual. There were a few bouncer questions. That's what the comments, few students said that there's more of rote learning, more of first and second year subjects. They were bouncer questions. Bouncer questions are always expected in INI-CET, AIM, GIM, or PJ, any of the Central Institute exam. Leaving that, quite a few routinely asked topics were definitely asked in most of the subjects. Bouncers were there, few of the one-liners were there, and AIMS always has a knack of changing everything, like multiple options, making the question lengthy. They don't let us predict it. That is maybe their USP. They wanted to have the upper hand, so that they always will have it's AIMS. They have to maintain their status for sure, right? So that's a reason I feel that some of the students are down. It's a very decent paper in the initial recall. We'll definitely, all of us will come with a mega recall session very soon. We'll announce to you. so that you'll have a proper recall with all the options, and hope that will help you guys. So, sir, there are few students which said that there are lots of questions from first and second prof. There's a poll in the Telegram channels, and there most of said that quite a few of them said there are lots of basic science questions. What are your take on that, Ankit sir and Santosh sir?
So let me first answer. If Santosh sir allows me. Okay. So yes, sir. We saw that especially PSM also we have forgot to include that the first, second year and PSM subjects. PSM has a major chunk of question this time, and as expected, yes, pre and paraclinical subjects, yes. In every INI-CET exam, most of the time also, they form the major chunk. And even in certain questions of medicine and surgery, or if we take any allied subject which have some portion, the connection with these subjects, the questions were very integrated also. The clinical based questions, they were also integrated. So yes, I think we need an integrated knowledge of all 19 subjects. But yes, this year, as you said, sir, few bouncers have come, few new questions have come, which luckily we have already discussed on PW Meded app. If I'll give an example, that we had put a post of a first drug which have been approved for Rett syndrome, that is trofinetide. And this questions actually, I think we had discussed also, and it was a straight away answer, yes or no. If you know it, you will mark it. If you don't know, sorry, you have to leave that question. Otherwise you will go into the negative marking. But yes, so it was very important. The students who were with us from past 2 months somewhere had a little bit amount of upper edge. Yes, sir. Santosh, sir.
Yeah, I do agree. Normally, the usual story after every exam, students fail to recall medicine questions. Like medicine questions get recalled last because they're lengthy clinical STEM, and mostly they relate to the basic sciences aspect of that STEM, and then they will call it as either a biochemistry question or a pathology question or a pharmacology question. Quite late, after a few days of the exam, then the whole STEM gets constructed. Then we can brand it as both medicine pathology or medicine pharmacology question. So as of now, I have very little idea from the conversations with students that the questions were, according to students, they were not like the usual kind of questions. And when it comes to medicine, mostly questions were integrated. So as of now, the questions are branded as being the basic sciences question. But as time progresses, we'll know more about medicine questions. Second observation is, usually we tell that the questions repeat and the topics repeat, but I often used to tell in my live sessions also that we should go a little lateral to the topics, and those topics also become important. So that trend we have started seeing in this INI-CET. So usually obstructive sleep apnea is a standard topic when it comes to medicine. They used to ask questions around it. This time the question was about obstructive, instead of obstructive sleep apnea, the question was about the obesity hypoventilation syndrome. So it is like a lateral topic of obstructive sleep apnea, which they have not touched usually in the last few years, but this time they had a question, straightforward question. But if you had gone a little lateral to the main topic, you could answer that. So that is then one important take-home message from today's session, that we need to go a little lateral to the topics, because that's how probably the exam setters will think also. Gauri is asking a question. She is right now in second MBBS, and she wants to know how can she prepare for INI-CET exam.
Okay, so I would take that question. Like, see, starting early is always better, right? And the most important thing I would feel that when you're in second prof, that's the time you will start your clinical postings in the first half of the day. So please do attend them. Don't skip them. That's very, very important. So looking at the questions, like whatever Santosh as well as Ankit has said, it's not that first and second year is predominant and final year is less. So what happens is I have 4 or 5 line questions. So finally, it comes to investigation or treatment. So students brand them as pathology or biochemistry or microbiology or pharmacology. So it's a patient. So what we are feeling in this exam or in most of the exams in the past few years is they are talking about a patient management. So I need to have a little bit of knowledge of micro, path, pharmacology, biochemistry, every subject to deal with the patient, to diagnose the patient, to solve and treat and without the complications. But few of them, yes, definitely there'll be pure pathology or pharmacology or medicine or psychiatry, anything. But majority of them is going to be mixed, because we have seen the fashion of integration quite some time from now. So if you're in second year, I would say learn pathology, let's say you're learning any disease about, let's say, tuberculosis, you'll definitely see TB cases in your medicine postings. You can definitely, your PSM also comes in a part of the second year. You'll read about the programs. So when you read about anything, it's about a disease from now on. It's not about a subject. So if I understand that I'm going to read about the disease, learn about the disease, be it the diagnosis, management, or complication, without the regard to the subject, I think that will be the best way to start early. So you have lots of time, and I think you can utilize the time very well to ace the exam. Right. So next thing, like there's a thing about always we have that direct repeat previous year topics and new topics. Amongst the conversation, what we got from the students, like there were 15 to 20 new topics. So to Santosh sir and Ankit sir, like what do you think the students should look forward in the future? Where do they get these new topics from? Should they go and read the new topics, or what's your opinion on that?
One good suggestion is the diseases which are relevant today are always important topics. For example, when we were running through COVID was an important topic, and there were a few questions related to that, especially in the INI. Okay, NEET PG, there were not many COVID-related questions, but INI had. So there are topics which become relevant. They are in the social media, those diseases are being discussed in the newspapers. Those are always going to be important topic. There was a question about the high fat meal, RDA of fat in the high fat meal, which is equal to nothing but the ketogenic diet. So now ketogenic diet is a fad among people who want to lose weight. A lot of doctors face inquiries regarding the ketogenic diet, and the INI-CET is well within its limits to ask a question related to something that as practitioners we're going to face. Right. Similarly, I was talking about the obstructive sleep apnea. Now, obesity hyperventilation syndrome is an underdiagnosed entity, though many doctors believe that the prevalence is very close to the obstructive sleep apnea. Awareness is there about obstructive sleep apnea, but not about the obesity hyperventilation. So it remains an underdiagnosed disease. Now, that is a relevant disease, right? Obesity is increasing. We are in a pandemic of obesity. It is a relevant disease, right? So what common cases that we see in our hospitals, OPDs, they are always important. Even if they have not touched in the INI-CET or NEET PG, they will touch in the subsequent years. So that's my recommendation, that important diseases that you encounter in your day-to-day clinics, make them important, even if you're not faced questions on that in the previous exams.
So your take, Ankit sir, how do they gather the new topics?
Yes, sir. It is all about experience. Remember, you cannot sail this ocean without books, as well as without your teachers who are updating you regularly. So it's a mixture. These two things should go hand in hand. Now, remember one thing. Let's say you're reading any subject right now. Let's say I'll take my subject, pharma. We know that pharma changes. In next 3 months, certain other new drugs will also come. So what you should do right now is make your beautiful notes, keep them with you for 5 years. Now, whatever the updates will come, which we will be posting on regular basis on our app and all the channels, we will be talking to you, all of you students, very frequently and on a regular basis. Any new information which we tell you, you should add those new information in your previous notes. You don't have to make anything new. You don't have to make your notes bulky. Just use any other, I would say, any other colored pen and put information there only. And remember, INI-CET, AIIMS PGI people, they are notorious in asking new drugs. Although you will not get these new drugs in NEET exam, once in a while you will get. But yes, in INI-CET, yes, you will get, because it is the most competitive exam. It is even more competitive than NEET exam. So hence, they are bound to put these type of questions. Only then they will be able to judge the actual domain of a knowledge, where you have a past knowledge and where you are, how much you are updated also. So yes, it is most prestigious institute. So yes, you have to be on the top of your preparation if you want to get here. So this is my take. So make your notes, don't worry. Whenever right now you are in second year, when you will come to final year, meanwhile, any update which Ranjith sir or any other faculty, Santosh sir, me or any other faculty will tell you, add to your existing notes. Okay. Use those notes for next 5 years, read them repetitively. You will learn each and every concept by heart.
Thank you, sir. Gauri, again, you have asked a question, and I think Kishore has answered first aid for it. I have a take on first aid. Like first aid is one of the amazing books ever created, I would say. Though it's for USMLE, I wouldn't say it's just branded for USMLE. It has an amazing way of, like, the only thing about first aid is don't read first aid when you're in MBBS. To understand first aid, you need a good amount of knowledge of all the subjects. So maybe once you are in the middle of final year, or maybe once you have completed final year, because first aid reads system wise. So it's a compilation of everything. For the first reading and second reading, if you use first aid, I think it would become bad. But once you have a basic knowledge of all the diseases, first aid is really an amazing source. Use it in the correct time. And using the correct time, it's like a rapid revision of every subject put together in a concise manner and what you want to know and what you don't want to know, right? So that is my take on that. And thank you, Gauri, that we are able to help you in your classes. Fine. And there is a thing like always there's been questions on images. IBQs has been become a trend once the online exams are started. Because when I was writing exam, it was offline. So AIMS or JIMR or NBE will never print papers to give colored images. Once it became online, more and more of images came, and its videos also came sometime, right? So how do you think, Santosh sir, how do you think we students should tackle IBQs, or if at all a video-based question comes in future?
Okay, the video-based question, as of now, the best way to pick the video-based questions and get the right answer is to spend some more time in the wards, because there's no limit what can be asked. And NBE will probably source the images or the videos from their central institutes or the other government medical colleges. And there is no dearth of clinically good relevant material in central institutes and government medical colleges. So anything can be asked. So more time you spend with patients in wards, you will be able to pick up more video-based questions. Right now, there is no other simple alternative. In our lessons, we try to bring up some of the relevant videos. So most of the medicine videos, video lectures, whenever there is a need for a video, a tiny video is inserted into the lessons. All the murmurs, we have inserted the sound. So even if audio-based question appears in future, you can probably tackle it. But still, my recommendation is spend your valid time with patients whenever you're posted in the clinics for videos. Images, personally, what trend I have noticed is most of the images when students share with me, I have to do some exchanges saying, did it look like that? Did it look like that? Ultimately, students say, sir, this is the exact image that came. Most of them are Google search images, and those images appear in first 1 or 2 pages of the search, not beyond that. So when you're learning something, if you're picturizing it mentally, go to Google and search for it. You will probably get the images. That you will develop a good visual memory if you have this habit of, after listening to a lesson or after completing a chapter, if you just Google search the images, that all the named signs, all the named findings, if you have a habit of doing a Google search, not just depending on the images shown by the faculty or images given in the books, if you have the habit of Google searching, then it will take you a little ahead, and probably you'll be able to tackle the image-based questions better.
Thank you, Santosh. I think Google is available everywhere. I am sure quite a few students will be using Google on a daily basis, like all of us do these days, right? A little bit of extra effort to learn new things definitely might fetch them good marks there. And Gauri will come to you again one more question. Like before that, to Ankit sir, there are a few questions which are like PGI type, because these days students have lost the knack of writing multiple choices, because when PGI was there, PGI Chandigarh was there, you had multiple correct options, right? 1, 2, 3, or 4. So that has gone over the period of years because the number of questions became less. So this exam had a little bit of them. And also statistics especially was a bit difficult. There are a few Kaplan-Meier curves asked, which is not ideally an UG topic. So when you go to post-graduation, we learn about Kaplan-Meier curves, kappa statistic calculations, which are more of like research topics. So these are like bones. These are the ones which make the student evaluate, saying that AIMS is difficult or INI-CET is difficult. So this doesn't constitute the 20%, 200 questions. These are some of them. So how do you think this will definitely happen in near future in every exam possible? How do you think a student should tackle that? Your take on that, Ankit sir?
Sir, if I would have been a student, I would have straightforward left these questions. The reason is I don't expect right now the student, these questions, remember AIMS people, they and PGI, INI-CET exam, next year it will come with some another surprise, sir. Right now it has a surprise of, let's say there is a question on a clinical trial, on a keynote trial. Although that question, without that fancy name of keynote 9 trial, that questions was asking about 2 drugs, pembrolizumab, nivolumab, where it is used. Now, the point is they were trying to make this question a little bit, you can say, horrific to read actually. We have already discussed, yes, these two drugs are used in small cell lung carcinoma, but they made it horrific to look like that students should come under stress. Yes, now, if we see the questions of these Kaplan-Meier plots and all, yes, again, the student will have a fear and they want to create fear inside you. But remember, if you read that question properly, the answer is very simple out there. Like, sir, in your pathology, you used to say that don't look at the slide, look at the patient. Look at the patient history. By that only you can crack that exam. You're able to answer it. Same thing was here also. These curves were given to make you stressful, to create anxiety inside you. But if you recall your notes, I am damn sure out of 3-4 questions, you'll able to answer most of them. Still, if you are not able to answer, remember, more than 95% of the students should leave that. If they don't know, they don't have a slightest idea, leave them. Don't go into the negative marking. Agree? So this is, I think, always be on a safer side. Don't take too much of guessing. If you are already at a very good score, don't do much of a guessing and rather reduce your score. So I would say if you don't have an idea, you are not able to calculate what is there, leave it.
Yeah, I second that. In the history of entrance exam, no one has done 100% score. Right? It is next to impossible. Right.
Sir, I remember JIPSU exam, the cutoff goes to 35%. And what happens in INI-CET, because I did my DM from PGI Chandigarh only. So the point is, JIPMER had a cutoff of 35%. Every year, either JIPMER or PGI or AIMS, one of the AIMS, they set up the exam. And I believe that this time either PGI or JIPMER have set up the exam. And the cutoff will be going a little bit low as compared to the previous INI-CET.
And the second reason is all these googly topics, they require too much of labor and the yield is less. You never know next time whether they were going to ask on those topics or not. So chasing those googly topics is counterproductive rather than solidify your understanding of other relevant, important topics. That would be my take on this. Like every year, some new topic will crop up. But rather than chasing those topics, the time-tested topics and those areas should be focused on.
True. I'm aligned with what both of them said. Like, if any exam, if my mantra is like, if you cannot narrow down into 2 options, don't touch that. If you're not understood the question, don't touch that. If it's a new syndrome, don't touch that. New drug, don't touch that. Because there is more likely chance of you going negative than being positive. If lady luck is on your side, you become positive. Otherwise, it's inky pinky ponky. It doesn't work. So rather than focusing on it, because I'm sure from now onwards till the next INI-CET, people will start Googling more and more curves, more and more statistics questions, and more monoclonal antibodies. That, like Santosh said, it's going to be counterproductive. Rather than that, concentrate on the 75 to 80% of them, which were normal. Any normal MBBS student with an extra effort will know. So we'll concentrate on that, learn that, read that, revise, retain, and hopefully that will help you fetch a good rank in the upcoming exams. And also, like, what is your strategy, Santosh, like on how many questions should a person attend out of 200? What do you think is a safe number of questions to be attempted?
Yeah, see, obviously we should be aware that there are negative scores. And as I've already told you, no one scores 100% in any of the entrance exams, neither in the past, nor it's going to happen in the future. So 185 to 190 is a safe zone when you want a really good rank. And maybe 140 is a good score to get if you want to rank within 1000 or 800. If you're aiming for a peripheral INI, a peripheral central institute for some subclinical or other branches.
Okay. Pikachu, a question on to you, Ankit sir, how to start preparation for next PG or NEET PG from second year?
I would say rather like you read your novels, you read any other book or any other story, you watch Harry Potter. Just right now for a few years, make this Harrison or make this book of Robbins as your Harry Potter. Enjoy your subject. And 3 years is pretty long time to make wonderful concepts. And I'll tell you the beauty of it if you'll study sincerely in first and second year. And when you will come to final year and when Santosh sir will be teaching you, before Santosh sir will be teaching you anything, you will be able to answer. Sir, this is the answer we have discussed in second year. So remember, first and second year, do it very properly. It will create a base where you can build your foundation. And then in final year, your foundation will be solidified by clinical subjects. And then at that time, you will really feel the beauty of medical science, I would say. Right now, initially, you will have a little bit of confusion, sir. What is this? What is that? Keep up your hard work, okay? And enjoy your subject. Remember, if you're not enjoying it, I would rather say, then the journey will be tougher for you. So first thing, if you want to be a doctor, you should love medicine by heart. Everything will be easy. Yes, for updates, if you are stumbling somewhere, your concepts are not clear, we are there for you. Okay.
Thank you, sir. And Gauri, again, you have a question of whether the lecture notes will be sufficient, and what's your take on this, Santosh?
Okay, there are a few things. For an examiner, there is infinite level of information to frame a question. So no one can stop examiner from framing question which is not discussed in Harrison. Many times it happens. Like Harrison is 3,000 pages plus of content, but even then 1 or 2 questions come beyond the purview of Harrison. So I cannot say even Harrison is sufficient for medicine if you want to crack every question of medicine. But obviously we should know what is time available with us for preparation, what is our level of basic sciences understanding, and then make a right choice of the resource. Yes, you will find resources which are very exhaustive. There are resources which are very concise. So the right choice is all that matters. So we have tried to keep it at a point where it is revisable. I personally believe that if you can't revise, it's very difficult to remember stuff, and it leads to more confusions in the examination hall than making it easier. So we have kept it at a level where it is revisable. So as long as that is your objective, I think the lecture notes are more than adequate. And to even answer your final props, I think the lecture notes should be more than adequate, because at the level of final props, they're not looking for objective details. They will be mainly looking for the framework of your answer. So if the framework fits, you will get a decent enough marks in the written paper. So for that also, notes should be adequate. But if you want to know everything in medicine, and in that case, I would say even Harrison is not sufficient.
True, very well said. Like for a competitive exam, the notes have been a concise form. That's all. So it's not like that. Everything will be taught in notes, and every question you answer is not going to be from notes. You already have a beautiful basic knowledge of medicine, and the notes and our teaching is going to concise them and make them more focused towards cracking an exam, towards acing in competitive exam. So I'd say with your existing knowledge, you add on to it. Like Ankit said previously, said, if any new pointers comes, you please add on to your notes so that it makes it much more concise. Shreya has a question of when there'll be NEET or next exam for 18 batch. Honestly, Shreya, no one in India knows that. Maybe except for our PMO, no one really knows when the exam is going to happen, and we are all eagerly waiting for the notification to come. Like you and be it your HOD or your dean or me here sitting here, everyone is waiting for that. So till that, whatever we say are going to be predictions and assumptions. So we'll have to wait for the government to give a clarification on that. Beyond that, only once it comes, we'll definitely take a call on how to pivot, how to do the exam preparation better. We'll definitely come live and discuss with you again. Fine. 2 problems in the app, Vignesh. I think it's done. If it's not done, definitely it'll be done soon. And printed notes, Sanathani. Yeah, printed notes. We are kind of first. Our thing is to finish the soft copy notes. There are 7-8 subjects are completed. Rest also will be completed in due course. Once that's done, yes, printed notes will be started. We'll print it, and we want it of a better quality than rushing it. That's why there's a little bit of delay. Apologies for that, and definitely we'll get back to it very soon. Right? Ankit, sir, question to you. What do you think? Like whatever you read, right? Like let me read an amazing textbook or an app or a notes, whatever it do. Finally, it boils down to the 3 hours. What they're going to sit in front of the computer, 3 or 3.5 hours. So what are the tricks you have, or what ways a student can solve an MCQ better? Is there any way to avoid silly mistakes? What's your take on that?
So I would say, I think sitting for 3 hours continuously is very tough. I personally feel that I can't watch a movie of 3 hours, which is very entertaining. So right now I am hearing a medical lecture for 3 hours. It will be even tougher for me. Now the issue is, I'll tell you what we used to do is, we read generally for 1 hour. There is no hurry in life right now for you. Read it for 1 hour. Take a 15-20 minutes break. In that break, don't text your boyfriends or girlfriends, I would say, rather. In that 15 minutes, what you should do, assimilate and think about it. Make a story in your mind. what you have read. And just remember, there are a lot of information. The only thing you have to do is, which no other person can do, is you have to link all the dots together. What you have read, create a story of it. And all the faculties, this is what they provide you. They provide you lecture in a story basis. Now, after you're hearing a lecture for 1 year, sit back, relax, and recall that story. Now, when you watch a movie 6 months, suppose you have watched a movie 6 months back, and if I'll ask you today, what was the story of that movie? Probably you will tell me the story properly. But if I'll ask you a question that what you have read yesterday, you don't able to recall it. What is the basic fault in this? The basic fault in this is that the movie which we watch, it has a proper story. It has a proper, some priori, posteriori, the linkage of events are there. Now you have to read your lectures in such a way that you can link all those events together. Make it as a story. You will never forget this story when you are attempting any exam, whether it is NEET, INI-CET. This story you can recall very easy, and I'm damn sure you will able to mark the answer correctly.
Thank you, sir.
Plus, it will also, sir, create interest also in reading a subject.
Sure, it does. Santosh, what is your take on for students who are sitting for the NEET or next 2024? What's the road ahead? So now we have had an INI-CET, and I'm sure quite a few of the students will be aiming for the next NEET PG, must have also sat for the INI-CET. So what's your take? What should they do in the upcoming maybe 6-7 months, keeping in mind if the exam is in Jan or March, we don't know yet. Keeping in mind 6-7 months, what should they do?
Okay, my personal suggestions would be believe that the exam is going to happen in Jan so that you will be better prepared. So divide your time, make sure that you have at least one more round of revision apart from your one regular reading, at least one round, preferably 2 rounds of revision that will solidify. Right now, if we are thinking of 6 or 7 months of time at our disposal, in that case, probably choosing a new resource or trying to go too exhaustive would be counterproductive. Rather than stick to well-tested basics. The basics is that a lot of topics are going to be repeating. The common diseases are going to be the center point of most of the examinations. So mostly concentrate on those rather than trying to chase newly emerging issues. Well, there will be updates. Like, for example, there were questions from the newer drugs. When those updates will come, probably just rely on the faculties and probably we will share them up, right? Medicine is quite predictable. So we know when the international conferences happen, in which month, and in which month the particular guidelines come. We know when GINA guidelines will come for asthma. We know when GOLD guidelines will come for COPD. So timely you will be receiving updates, and obviously the updates will be huge. We will filter it down and probably will put across what can be created as an MCQ or what can be asked as a question. Not everything is testable as an MCQ. So those points will be conveyed to you through social media posts or through the Telegram channels. So for updates, just rely on the faculty members. Otherwise, stick to the basics, listen to the video lectures, solve the MCQs. One recommendation is that helps you build a good memory is try to summarize what you learned. Again, I'm just saying same thing that Ankit sir said. After you have completed a chapter, if you can sit down and write the summary of it, even half a page of summary of it, you will be able to remember it better. And another approach I generally tell students is, can you define a disease after you've completed reading it? If you're able to define a disease, right, make an attempt to come out with your own definition that helps you to understand the lacunae in your understanding of the disease, understanding of the management and everything. So that will set you back a bit, but that extra effort that you put, right, will solidify your foundations better and you will minimize errors in your exam. And when your foundational understanding is good, probably you can take a little bit of chances on questions which are not directly related to the topic, but they're lateral to the topic because you understand this topic very well. So you know what is not about this topic and you will be able to deal with that. Second thing, time management is crucial. At least 8 to 9 hours of preparation per day would be needed if you're post-internship. If you're intern, at least try to squeeze 3 to 4 hours of preparation. And those times, keep it dedicated to the resources and spend time with the books or the question banks or the app, not on the mobile phones or the social media. And one more important thing is, right now, give up on the reels and Instagram or social media where you get information in a tiny formats, because we get addicted to consuming data in tiny formats and it becomes very difficult for us to sit with the books or the video lectures if you are addicted to short format entertainment.
True. Thank you, Santosh. To add to whatever he said, like when you're sitting in exam, there are silly mistakes which is going to take away your rank. So try to read the question carefully. The negatives or the double negative statements is very, very important. Look for the histories. That's very important. Generally, we tend to miss the age and the gender. Sometimes that might be the only clue required to solve the question. That's important. Don't look at the images, be it any question. Look at the history, try to solve it, and then go for the options. Uh, Mostly there's a fact-based question, right? Because facts are something which you must have read in your first year of MBBS, some nerve supply. You might have not recollected it later. But when you look at a question first time, when you read the question first time, it will strike you, okay, this could be the probable answer. But what we do is we overthink and we make a mistake and come. So that's your latent memory. You are not believing yourself that you know it, right? So anything which is instinct based, especially for a facts, please do it. Go ahead and mark it, because most of the time you must have read it in your 4 or 5 years of medical career. That's there in your memory. It's just hidden. It's not coming to you in the right way. That's what your instinct is. Instinct is not just some person coming in telling it to you in your ears. It's your own memory. It's lying dormant for quite some time. Please go with the instinct. That always helps. PYQ topics, and like Santosh said, little bit laterally surrounding the PYQ topics will definitely help you to fetch more, right? And loan.
Brought up a very valid point. You said, right, overthinking. In one of the NEET essays, there was a question asking you which cells in the pancreas secrete insulin for NEET super specialty. And trust me, 2/3 of the students answered it wrong because they started NEET essays में ऐसा question क्यों आएगा? So they started thinking that overthinking led to many MD pass outs giving wrong answer to those questions. So I think we should minimize, and sometimes we should believe our instincts, especially as you said, the fact-based questions.
It's very important. Lone Wolf asks a question of rapid revision. There will be the rapid revision series for interns. Like we said, like maybe it'll take some time for us because we are waiting for the government to announce something concrete for this year, so that we can devise whatever we have the live batches according to that. If the government is not going to tell anything for the next 1 month or two, we hope that it will be NEET PG and we'll be going in that direction. Right? Okay. Shreya has one more question. What's the probability of cracking NEET in first attempt in private college, and what should be a study routine, number of hours as an intern? Ankit, sir, you want to take the answer?
Sir, I'll repeat that story again. 3 years back, I went to China. I'll repeat the story again. And I think it is one of the most inspiring story I have ever heard. I ever seen, I felt. I went to China, and there was this MBBS student. And in China, the problem is there is no faculty who teaches in English. So that student used to read himself. So chalo, I have revealed the gender of that student. I want to tell you, Shreya, that student got first rank in NEET PG exam. And that student was an FMGE student. So it doesn't matter from where you are doing MBBS, from which college you are doing. It doesn't matter. That is a past, and past you cannot change. What you can change right now is your present, which will decide your future. The point is, the only key to crack any exam is consistency. If you can give 1 hour, 2 hours, and if time allows 3 hours every day, if you're consistent, if you're disciplined, I'll bet right now that you can crack any exam. Okay, just love the subject, be consistent, you will easily crack any exam. Okay, if you have doubts, ask us, we are there for you. Okay, we will also work hard with you people. And yes, and I hope in future you will be one of the topper, I would expect.
Yeah, and as consistency is very, very important. More than some of the supercharged days where you read from morning to midnight. Instead, if you maintain a consistency of even 3 to 4 hours per day, that will yield better results than some supercharged days. That's my take.
Thank you, both of you, and thank you,
May I
guys.
ask you one question, sir? Sir, there is a student, Lone Wolf. He is feeling a little bit alone. He's asking that will be there any rapid revision for subject for interns?
Yeah, like I said, like we will wait for the government's announcement for next on NEET, what is going to happen. Maybe sometime we'll get more clarity, and like I said, we'll definitely go with that, sir.
Okay, sir.
Okay. So thank you everyone for your time, and the recall session, the marathon recall of PW, every faculty will be coming on 10th of May. and we'll give you the entire schedule. It will be a very long session where we are doing it a little bit delayed because we want to have a very accurate record. Rather than having this might be, this might not be, only two options, we are trying to frame the question so that the source, the PDF, whatever we get, will be definitely be useful for the next year preparation as well, the next exam preparation as well. We'll be having a marathon recall on 10th May. We'll put up the time on the YouTube channel. So if you're not subscribed to the YouTube channel, please do it. And definitely we'll talk more thing, and all 19 of us will come on the same day so that you can complete the entire paper in a day. Okay. Okay, so thank you for everyone for your time, and if there are no more queries, and we'll call it a day. And if you have any more queries, you can ping us in the Telegram group. We'll be more than happy to answer your queries. Fine. MS Auto, we don't know about the INI-CET number. We'll talk about it soon. Fine. Thank you, sir. Thank you, Ankit sir. Thank you, Santosh.
Thank
Okay.
you. Thank
you all. Thank you, guys. Have a good day.
Have a good day. Relax today. Don't take stress. Relax for 2-3 days and get back charged again.
Thank you, sir.